Greetings, this is the coronavirus COVID-19 update for 3/16/2020. And looking at the Baidu page, a Chinese search engine who has a dedicated page for coronavirus. The cumulative cases down on the bottom left, 81,116, up only 39 cases from yesterday, which is, thousands better than Europe and the US. And deaths at 3231, which is up 13. And if you scroll down the Baidu page, you can see the map changing every day. I kind of put in several here to show the changes from the upper left to the lower right. The big map is the current one, and China is now they changed this map to represent the total number of cases minus the number of recoveries, and that's what it looks like today. A lot more provinces you can see are turning white, and they're using the same legend on the lower left that they always did, but I think everything's getting lighter colored. Then if you scroll down more, you see the first of three graphs. This one shows a number of new deaths at 13, new diagnosis 39, which is crazy low compared to the rest of the world. And added cures, additional cures, which is recoveries. Actually, China's not they're not curing that many people. And if you scroll down, you can see Hubei province has only one suspected case, and non-Hubei 38. So you see a trend going up the last couple days of non-Hubei and national, and that's just from the 13th to the 16th. And a lot of that has to do with there's some more. Well, we'll get into it in the stories, but there's some community transmissions that are happening, and there's also some foreigners coming into the country. And this is the third graph, and this shows the number of new domestic cases compared with elsewhere in the world. New cases in the world 10,000, 11,000, and domestic 39. So China's doing something right. Then if you scroll down further, you see a list of provinces, and I sometimes open up Hubei if there's something going on, but I didn't today because I wanted to see where all those 39 cases are, and the numbers aren't updated yet. Then there's a global map, which is useless. And then if you scroll down further, you see some hot searches today. So these are search terms. Remember, Baidu is a search engine, and these are Chinese people looking for stories about coronavirus. So we'll take a look at 7 of these. So the first one, you can see the Johns Hopkins tracker here, which is what I use, and this is a story about the number of deaths outside of China has surpassed the number of deaths in China. I don't know why that's a fuzzy picture. I couldn't find a good one. And on the lower right, residential area unblocked in Hubei on the 17th. So this is a few days ago, they came out with news that this area in Hubei would be opened up, and then too many people were found on the streets, so they canceled that announcement, and now they're announcing that tomorrow, or right now it's today in China, so that they're opening up a residential district inside of Hubei. So it's a pretty good news here. Hubei province. It's not in Wuhan. It's another city. Then other stories. Let's see prevention of foreign. So they're coming up with some policies about foreign travelers entering China. And on the right, this is a related story. This is a hospital, 1,000 bed hospital that's opening in Beijing, and it's going to be only for foreigners coming into the country that are sick. So, now China spreads the virus all over the world. Now they're worried about, the rest of the world coming into China because only 39 new cases in China and the rest of the world is far, far worse. Then on the left here, we have, they're talking about community sicknesses, and they're still seeing some. Here's a delivery guy probably delivering food. Most of the people, if this is in Wuhan, most people in Wuhan are still depending on grocery stores and restaurants, mostly grocery stores, to deliver food to them. And since, these residential towers could be, 60 stories high, a lot of times the agreement between the grocery stores and that tower is we deliver the same thing to everyone. So you know what you're having for dinner. You know what your neighbors are having. They're having the same thing you are. Upper right, the announcement of conviction for concealment. They're finding a lot of cases where people are, trying to break the rules, and they're saying now that, if you conceal the fact that you are tested positive for coronavirus and you're out and about somewhere, convictions are possible, which is not a good thing in China. And on the lower right, Buffett's daughter is in self-isolation. Then we go to the Johns Hopkins tracker, which is what the world uses. I've been using this for, over a month now, well over a month. And this is from a research institute at Johns Hopkins Center for System Science and Engineering. And they're showing a number now of 181,000 people infected worldwide. It wasn't that long ago we hit 100,000. In total deaths, 7,126 deaths. And you can see below that, 3,099 deaths in Hubei province. Now that's only one province, but even that, the number of deaths, outside of Hubei is pretty small. This graph on the lower right is just crazy. It's, it's finally they changed the scale on the left, but it only goes up to 120,000. And these lines just don't make any sense. You have mainland China and other locations. I think this might be recoveries because on the right it says, for green it says total recovered. But then why isn't the green line above the other two? Something's whacked up here. So one thing I look at every day with the numbers is I look at China's latest numbers, 81,116 compared to what we have, and it's pretty close. So it doesn't affect that total number that much, 100 some off. Then what I have been doing is tracking the traditional 3 hotspots in the world, but now we have Spain moving up into the top 3. But I'll still take a look at the 3 traditional hotspots. So Italy, Iran, and South Korea. And South Korea, due to this issue they had with a church that has 450,000 members in South Korea, and they were recruiting people in Wuhan, in China. And they had an outbreak that went from 0 to like several thousand in a matter of a few days. But since then, South Korea is now the model country, for stopping the virus. They have very few new cases every day. Italy, though, is pretty alarming. So Italy here up over 3,000 cases today. And if you look on the right, deaths, 1,809 yesterday, 2,158 today. That's not as bad as a number of new deaths yesterday. In Iran, you don't know what's going on in Iran. So we'll take a look at these 3 hotspots, stories that affect those. So first in Italy, on the left we had, the victims are 1,809 in a single day. Deaths are 368. So that was yesterday. That's like a world record for the number of deaths in a day, including China. And new news, we have over 23,000 positives, but the trend is downward. It's not really downward. I don't think this guy's a little too optimistic. The number of deaths went down, but Italy does not have anything under control. So a lower left story, roadblocks have started in Rome today. They're blocking off sections of the city. and also, barring people from entering Rome. On the right, police checks, 20,000 people reported in 4 days. And this is for, if you look at the lower left there, there's given false statements to police, like the reason I need to go out today. So, they're really clamping down on people traveling around because why? Because, the number of cases in Italy is just out of hand. Then the number 2 hotspot, Iran. I don't even bother looking for new news in Iran. This is a couple days old. Iran, it's immoral to let a bully kill innocents. They're talking about the United States. They want the United States to drop sanctions because it's affecting their ability to fight the coronavirus. It has nothing to do with, idiots running the country and allowing hundreds of thousands of people in this little pilgrimage to this little religious site in Qom, and having people lick the sides of the thing. You see those pictures on the lower left. They're not afraid of coronavirus. They're going to lick the temple, and they're under arrest and facing flogging now. But they're not doing anything right, and sanctions doesn't have anything to do with it, despite what they're telling the UN every day. I mean, there's sanctions for a reason. You sent a general to Iraq to lead terrorists, to kill Americans at the American embassy. And then when the United States shot the general, killed the general, actually with, 4 small, highly accurate missiles that entered, 2 of them each in 2 cars, and blew them to hell and back. And the next day, Iran shot down a commercial airliner. That's why you have sanctions, because you're Iran, and this is just crazy stuff every day. I quit updating it because it's just all crazy stuff coming out of Tehran every day. Then next we have South Korea, which is the model country. On the upper left, you see this is up there from several days ago now. China and South Korea models seem to be the only way to contain COVID-19. And quarantine travelers from Europe strengthened. That's what happened today in Korea. And also the government, there's no lockdown in Korea. That's what's amazing about this. They have things under control after, jumping up to several thousand. Now, if you look at the number of new cases, 8162 to 8236, that's only up 70 cases from yesterday. So they're containing things pretty well without locking down the country. But they announced today, do not gather in enclosed spaces, and that includes churches. Because why? Because on the lower right, you can see that they had some, a lot of new cases connected to that same church. And along the bottom, these are stories from a few days ago where they announced what drugs they're using. So they recommend using HIV and anti-malaria drugs. And those 2 drugs, which are American, which is lopinavir and ritonavir, are both together now in one pill called Kaletra, and it's made by AbbVie Incorporated, which is a spin-off of Abbott Laboratories, and that's what they are using to cure their people. And their number of cures is way up there. They're leading the world in the number of cured cases every day, except for China. They have a lot more. China has a lot more people. So the story on the upper left, sometimes I try to put the yesterday's stories on the upper left. And this is what you can and can't do during Spain's lockdown. There's a big list of things I went over yesterday. Can you walk your dog? Yes. Can you go visit your family for dinner? No. Can you go to a grocery store and a pharmacy? Yes. A bunch of things you can and cannot do. Can you go care for a loved one? Yeah, if you're responsible for that person. But, today, Spain's number of coronavirus deaths and infected cases soar in 24 hours. Some 2,000 cases higher. And, Europe's second most affected city after Italy. Well, not for long. You guys are going to catch up with Italy the way you're going. And the city's supposed to be on lockdown, but, also a story that was published today on the lower right, which is March 16th, which is, today, Spain time at noonish. City commuters complain about overcrowded trains. So How do you have a lockdown when you have people using public transportation complaining about overcrowded trains? I don't understand that. It's either a reporter did a story that came out a couple days after he or she wrote it, or what? I don't know. But Spain's out of control. Then we look at, what are we looking at? Germany. So Germany, I look at a couple sites every day. Der Spiegel and Das Welt. The Mirror is the first one. Closing time in Germany. Closing time. So, and then the World is a coronavirus. They have a page set up for that. And instead of looking at all of these articles, I just highlighted them here. I did open them up. No job should be lost. One of the politicians are saying that, even though you're going to be home and people aren't going to, this is the same issue all over the world. A lot of people, who work for a living, cleaning basketball arenas in the NBA, they're not working now. And NBA players are trying to take care of those people who take care of their arenas. And then the second article was how everything can be tracked down, back to one ski resort. That's a lot of these countries, like Italy and Germany, they can track, their virus infections back to people visiting from Wuhan in the early days. And then from France, doing two on this page, Macron announces 15-day lockdown in French war on coronavirus. And on the lower right, it's crucial to implement the strictest measures as soon as possible. So that's, some in the United States, that's happening in some places like Ohio with only 37 cases yesterday, shut down all restaurants and bars. So that's, the strictest measures as soon as possible. Why wait until you have 1,000 infections or, several thousand? Then we have the US of A. So USA 4,661 and 85 deaths. 17 recovered. I have another video looking at some of this stuff, and I'll try to get it out today. But 17 recovered cases is like a world low. For 4,661 cases, only 17 people have recovered and been released from the hospitals. There's something wrong there. So cases are up from 3,774 to 4,661 today. Deaths from 69 to 85. And this is yesterday the big news out of the United States was that a vaccine was going to start a trial on Monday. It's not a clinical trial. It's just a trial on one patient, I think. The last I read was one patient. And, that's a good place to do it in Washington, in the Seattle area, King County probably. And then upper right, coronavirus shutdown spread across the U.S. as death tolls rise to 80. So more cities are following, or states are following the, shutting down basically. And the map here in the middle is a little bit, I used it because the only way to get individual numbers from cities on the big Johns Hopkins map is to click on the red circle. And here they have them listed. So I just wanted to show that the three states, New York, Washington, the state of Washington, and California, three states account for over half of our cases. And then that's the numbers on the 967, 904, and 557. Then the states that I have highlighted are the states yesterday that closed all restaurants and bars. I think New York, they're also closed now, but I'm not sure. Washington, California, Massachusetts, Illinois, and Ohio all shut down restaurants and bars yesterday, and today a lot of other states followed suit. Then what else do we have here? This is news outside of the United States about the United States. Test every suspected case of COVID-19 that WHO recommends today. Coronavirus is exposing all the weaknesses in the U.S. health system. Low medical capacity. I don't know if that's true. Low medical capacity? A low capacity to do tests. but I don't think our hospitals are low capacity. I think it's up there in the world as far as number of hospitals and beds compared to population. Then the UN came out with a thing today. China shows COVID-19 can be stopped in its tracks. Yes, it can be if you're a communist government and you lock down cities. And we'll see how lockdowns are going in New York in the next slide, I think. Yes, this is New York. The New York Post today came out with a bunch of pictures that are pretty cool. Upper left, that's Grand Central Station today. And the middle picture on the top, general view of the empty streets at Church and Franklin. So this is, a highly recognizable area and building. And Fulton Center Station on the upper right, and Times Square in the lower middle, and what do we have? Columbus Circle on the lower right. So basically, New York is starting to look like a ghost town. So they're following China's model of, locking down the city. And finally, this is a graph I put together because there are no graphs to show you the number of cases in the U.S. So as you can see, we started out with, way back in 2021, we had 16 cases before we repatriated people from the Diamond Princess cruise ship. And then went over 100 cases in early March, and lately it's just gotten out of control. You can see from 3/9 on, it's like a geometric increase every day. And today's is a little early. That 4661 might go up a little further. Okay, that's all the news we had today. Appreciate your time. And there's another video I'm putting out on the CDC.